My name is Dr. Mark Skeen. I'm an associate professor of neurology at Duke University Medical Center and director of the Multiple Sclerosis Clinic. I decided we really need to make some videos to try to record and make available to other folks the various conversations and educational interactions we have with a number of our patients. So this is the first of those videos, and we plan to record a number over ongoing months just to try to share our understanding and perspectives on multiple sclerosis and its treatments. This first one will be an introductory conversation about multiple sclerosis, what it is, and the various types of multiple sclerosis. And subsequent ones will delve deeper into various other issues. So I should say at first that this is a presentation solely for your benefit, for the benefit of whoever wants to view it. I should also say the opinions that I express are mine. They're not the opinions of Duke University or the Department of Neurology or any other organization, so don't blame them for what I say. These lectures have nothing to do with the pharmaceutical industry. Specifically, in other words, they're not sponsoring them or have any role in their development. However, for sake of transparency, I do sometimes consult to the pharmaceutical companies that make medications for multiple sclerosis and related conditions, and I sometimes give non-promotional presentations that are within the guidelines of the Duke conflict of interest approach in terms of our interactions with pharmaceutical industry. So if that affects your interpretation, I wanted to make that clear to you so you can make of that what you will. So at first, let's begin talking about multiple sclerosis, what it is. Multiple sclerosis is an autoimmune condition, and by that we mean it's a condition that results from our immune system attacking us. There are many autoimmune conditions. MS is just one of them. Our immune system seeks to attack or destroy bacteria or viruses or other foreign organisms that get into our body and could do us harm. It does so by recognizing the shape of the molecules that are on the surface or that are produced by those organisms. It's a very complicated system designed to do that, and it does it amazingly well. The challenge, or one of the challenges to the immune system, is that the manner in which it does so recognizes bacteria and virus is by looking at the shape of the molecules, particularly proteins and related molecules, often on the surface or otherwise produced by those pathogens, those invaders, if you will. Unfortunately, the molecules of our cells don't look particularly different than the molecules of viruses and bacteria when we're talking about the molecular level. So it's a tremendous challenge. And sometimes our immune system gets it wrong, and it recognizes our proteins or other molecules as foreign, if you will, and attacks those proteins or those molecules with the same ferociousness, if you will, that it would attack a bacteria or virus. And in so doing, it causes damage to us, like it would to those viruses or bacteria. There are many autoimmune conditions. Multiple sclerosis is just one. Rheumatoid arthritis is a condition in which our immune system attacks the joints. Type 1 diabetes is a condition in which the immune system attacks the cells in the pancreas that produce insulin and therefore results in diabetes. Many thyroid diseases are the result of the immune system attacking the thyroid and affecting the thyroid's function. So there are many different autoimmune diseases, and they have in common that it's the immune system attacking us, but there are also very different conditions in which the problem in the immune system is quite different. So that's the basis of multiple sclerosis, and why it occurs, we aren't sure. We know that there are many genes that we can inherit that make it more or less likely for us to develop multiple sclerosis. but no one of those genes gives us multiple sclerosis. We know that there are things in the environment that make multiple sclerosis more or less likely if we're exposed to them, and we think that might be an infection. But we've never been able to identify for sure what that infection might be or what to do about it, but research continues. Multiple sclerosis affects women more than men for reasons that aren't sure. And it's characterized by attacks. So most people who develop multiple sclerosis develop what we call relapsing remitting multiple sclerosis. It often occurs in early adulthood, although we think the beginning problems even start earlier, years earlier, the immune abnormalities. But often it presents in early adulthood, in which people will suddenly have some attack of a neurologic symptom. It usually comes on over a day or two and then gets better over weeks. And it may be rather mild and may be what I call ignorable by some people because it gets better. And they may go weeks or months or years before developing another symptom of multiple sclerosis. That's why we call it relapsing and remitting. The relapses are the attacks, if you will, that cause symptoms, but generally it also remits on its own. In other words, people improve whether we do anything or not, usually. Typically what happens over years is that relapses continue to occur. People usually improve after those relapses, but they may not improve all the way back to normal. But what happens over years and decades is that the nervous system gets progressively damaged. And after 10 or 15 or 20 years of having relapsing remitting multiple sclerosis, often what we observe is people enter a second phase that we call secondary progressive multiple sclerosis, in which they may or may not have as many exacerbations or attacks, but they may slowly go downhill from month to month and year to year, so that the character of the disease now is less of a relapsing condition and more of a progressive condition. So we call that secondary progressive multiple sclerosis. There's an additional, less common form of multiple sclerosis that we call primary progressive multiple sclerosis. It tends to happen in individuals who are older, maybe in their 50s or 60s, and they've never had any relapses. And they have slow progression of neurologic symptoms, and ultimately we do MRIs and other tests, and we find out that indeed they have multiple sclerosis, but they've never had relapses or attacks. They've just had a progressive decline. And that's always been the most challenging form of multiple sclerosis for us to treat. So I'm going to stop there for this video and let that serve as an introduction to multiple sclerosis, and we'll continue on with some more topics. And I trust it's been useful for you, and thank you for your attention.